Hi, this is Colleen, certified nurse midwife here at Reliant Medical Group. I am here to talk about labor. And what I'm going to talk about is the definition of labor, signs and symptoms of labor, some questions that we may ask a patient when she calls and says she's in labor, and then some preparation. So the definition, the labor definition. Labor is defined as regular uterine contractions with progressive cervical dilation and effacement that enables a woman to move through 3 stages and eventually have her baby. The first stage goes from 1 to 10 centimeters, fully dilated. The first stage is divided into 2 phases. The latent phase, which is early irregular labor, which could be anywhere between 1 and 5 to 6 centimeters. Early symptoms, mild contractions, just starting to get into labor. And then there's active labor, and that's usually about 5 centimeters till 10 centimeters. And that's regular contractions, some discomfort, some progression, obviously, of dilation. Also within active, there is actually another subset, and that's 8 to 10 centimeters, which is also called transition. And then, of course, next is second stage. And second stage is 10 centimeters, fully dilated, ready to have your baby, pushing the baby, and delivery of the infant. And the third stage, the last stage of labor, is delivery of the placenta. And that usually happens anywhere between 2 and 20 minutes after the baby is born. Sometimes might need to do a repair, and then there's recovery and initial bonding with babies. Signs and symptoms of labor. So the signs and symptoms of labor usually start to feel things such as the baby's dropped into the pelvis, increased urination, vaginal and rectal pressure, leg cramps, leg swelling, some back pain. Also start to have cervical change. The cervix is the bottom of the uterus. This is known as the cervix. That will start to change. It'll become ripe and ready. It'll start to soften, thin, and open. Possible rupture of membranes, that can sometimes happen. That's also known as your water breaking. Past mucus plug or some bloody show. Preparing, nesting, and sometimes women get an energy spurt. Nausea, vomiting, loose stool, diarrhea, can have some gastrointestinal symptoms that can be uncomfortable. And one of the biggest things that is the sign and symptom of labor are contractions. They start out mild, Braxton Hicks contractions, and irregular, and then they go on to true labor contractions that are pretty close, anywhere to 2 to 5 minutes apart. On to some questions that a provider may ask a woman when she calls when she's in labor. Is the baby moving? How close are the contractions? When did the contractions start? What baby is this for you? Is this your first baby? Is this your third baby? Has your water broken? Are you having any vaginal bleeding? If your water did break, what color is the fluid? If you are having some bleeding, is it just a small amount of bleeding or is it a lot of bleeding? Where do you live? How close are you to the hospital? When was your last visit at the office? And when you were at the office, was your cervix checked? Were you dilated? Group B strep status. Your Group B strep, was your culture that you had, was that positive or negative? How was your previous delivery? If this is your second or third or fourth baby, have you had a C-section? Recent ultrasound. Have you had an ultrasound in the past week or so? Do we know that the baby is head down or what position the baby is in, if the baby's breech? Do you have any major health concerns or any significant medical history we need to know about? Labor plans. What are you planning for your labor process? Do you want to have natural childbirth, medication, epidural? You have your support people that'll be with you. Will you have a doula? Your partner will be there with you, family. and some other information. What do you need to bring to the hospital? We can give you that information, and then where to check in at the hospital. If it's late at night, through the emergency room, or just come into the hospital, or even in the office sometimes during the day. And then lastly, some ideals and preparation. So some personal expectations for the labor and birth process, to do some planning, the amount of support that you'll have, the quality of your provider, the caregiver provider patient relationship, and your involvement in decision making. Those are all important factors. Your belief in the normalcy of birth, non-interventional of normal processes, normal process of birth, family-centered care, having active participation in the healthcare decisions in your birth experience, having good communication. Another really important factor is human presence, having someone present there with you when you're in labor. And then again, a continuous compassionate partnership with your care provider. So I'm Colleen Rifa, and again, certified nurse midwife with Reliant Medical Group. I'm in the office here in Worcester and also the New Milford office, and would welcome anyone to our midwifery practice.